Hello guys! Welcome back again for another video. So for today's video is we're going to return demonstration on different techniques of bandaging. First is we need to do the planning. So for the planning is we need to check the doctor's order on the area to be bandaged. As the case of our patient, the area that we're going to bandage is his lower arm, which is we're going to use a circular turn. Next, the area to be bandaged is his upper arm, which is we're going to use the spiral turn. Next area to be bandaged in our client is his lower leg, which is we're going to use the spiral reverse wrap. And then the next area is his fist, which is we're going to use the recurrent turn. Next is the area of his ankle, and we're going to use the figure 8 turn. And last area is his shoulder, which is we're going to use is the SPICA wrap. And next with the planning is nurses need to know what is the purpose of the bandage and assess the area which is requiring support. The equipments, we have bandage or appropriate size, plaster or bandage clips, clean gloves. When bandage are used to secure dressings, the nurse wears gloves to prevent contact with body fluids. Next is we're going to introduce ourselves, verify the client's identity, and then explain what you're going to do, why it's necessary, and explain also to the client how he can participate in this demonstration. Hi sir, good evening po. My name is Charlotte Wenagi Bustamante, your student nurse for today. Sir, ano pong pangalan nila?
Charlton.
Okay, Sir Charlton. Ang gagawin po natin ngayon is papalitan po natin yung dressing nyo at ibabandage ko po kayo. So, meron po tayong mga iba't ibang bandage techniques na gagawin sa inyo. So, ang kailangan nyo lang pong gawin is mag-participate sa akin. So, ang purpose ng bandage na po ito is para makontrol po natin yung bleeding sa pamamagitan po ng pressure. And then, para na rin po maging support po ito sa wound dressing nyo. And para rin po maprotektahan po yung mga open wounds natin from contaminants. Next is we're going to provide the client's privacy and we need to perform hand hygiene. And apply the gloves. Pagtas po natin isuot yung gloves is magpo-proceed na po tayo sa pag-a-assess ng ating patient. So, first is we need to inspect or palpate the area for swelling. So, inspect po natin yung ating mga area na lalagyan po natin, ibabandage po natin mamaya. So, inspect po natin for swelling.
So far, there is no presence of swelling in client's arms, legs, and ankle.
Next is we're going to inspect if there is a presence of wounds and the status of the wounds, because open wounds will require a dressing before the bandage is applied. So, sir, check po muna natin kung meron po kayong mga sugat or open wounds. Tingin po. Okay po, wala po sa kanyang arms. Okay po. Wala naman po kayong open wounds. Next is we're going to note the presence of drainage such as the amount, the color, the odor, and then the viscosity. So far is wala naman pong drainage ang ating patient. For next is we're going to inspect and palpate of adequacy of circulation of our patient, such as yung kanyang skin temperature, yung kanyang color, and then yung kanyang sensation. Okay. Sir, inspect ko lang po kayo. The temperature of our client is warm, and then his color is brown, and wala naman pong presence ng tingling or numbness. The rationale of this is because if there is a pale or cold temperature, tingling, or numbness, it indicates that the patient has a impaired circulation. Now, for the next is we need to ask the clients if there is any presence of pain. Sir, may nararamdaman po bang sakit sa inyo? Okay lang po kayo? Okay po. So, ang unang bandage technique ang ituturo natin sa ating patient ay circular turn. So, ang ating babandagean ay yung kanyang left arm. So, una is, kailangan, sir, dominant hand po yung bandage. Then, wag po natin ididirekta sa mismong sugat kasi nagkakos po siya ng discomfort. Una is, magto-turn po muna tayo ng dalawang turn sa bandage. Again, secure lang po natin ng thumb at ng index finger. Okay. Then, pagkatapos po is, ito-turn po natin siya 2/3. Okay. Mahigpit po ba, sir? Or okay lang po?
Hindi po.
Okay, hindi po siya mahigpit. Okay. Okay, not too tight and not too loose. Okay. Then, pag nare-reach na po natin yung dulo, is i-turn lang po natin siya ng dalawa para ma-secure po yung bandage. Then, naglalagay lang po tayo ng clip to secure the bandage. Okay.
Circular turn are used to anchor and secure bandage.
So, for the next technique, ang ituturo naman natin sa ating patient, yung spiral turn. So, ang area na paggagamitan natin ng spiral turn ay yung kanyang left upper arm. Sir, next na technique na ituturo ko po sa inyo is yung spiral turn. So, again, katulad lang din po kanina sa circular turn, is kailangan po natin gawa ng dalawang circular turn. Then, next is kailangan tayong mag 30-degree angle. Then, again, is hindi po natin idedirekta yung bandage sa may sugat. Sir, hindi po ba masikip? Okay lang po ba?
Hindi po.
Pagkatapos is kailangan po natin siya i-clip ng bandage clip. Okay.
Spiral turns are used to bandage parts of the body that are fairly uniform in circumference.
Okay, so for the next technique, ang gagawin po natin sa ating client ay yung spiral reverse. So, sa spiral reverse is katulad lang din po siya ng spiral, kaso i-turn po natin or iikot natin yung bandage. So, turuan po natin yung ating client. So, ang area na paggagamitan natin ng spiral reverse ay yung kanyang lower leg. Sir, ngayon po is tuturuan ko po kayo ng spiral reverse turn. So, katulad lang po ng dalawang nauna is kailangan po natin mag-turn ng dalawa. Dalawang turn po ulit. Then, with the using ng ating thumb is itutupi po natin or ito-turn po natin yung ating bandage. Okay lang po ba, sir? Hindi naman po masikip.
Hindi po.
Then, tsaka po natin siya i-clip using ang ating bandage clip.
Spiral reverse turns are used to bandage cylindrical parts of the body that are not uniform in circumference.
So, for the next is recorded turn. So, this is the stump area. So, sir, magta-turn lang po tayo ulit ng dalawa. Okay. Then, i-up natin. Then, pabalik natin sa gitna. Balik natin. Then, kailangan natin siya i-secure. Pa-forward. Balik ulit. Hanggang sa may makita na po tayong figure of 8. Then, pag na-reach na po natin yung dulo, is i-secure lang po natin ng dalawang turn. Okay. Then, secure lang po natin siya ng clip.
A recurrent turn is especially beneficial when wrapping the stump of an amputated limb or the head.
So, for the next technique, ang ituturo po natin sa ating patient is yung figure 8 turn. So, ang ating area is yung kanyang ankle. So, again, is kailangan natin mag-turn ng dalawa. So, again, sir, kailangan po natin mag-turn ng dalawa. So, importante po na mapakita po natin or wag po natin tatakpan yung toes nyo po para makita kung merong impaired circulation, and then i-advance natin.
Then, we carry the bandage about the joint, around it, and then below it.
Then, ganun pa din po. 2/3. Then, kailangan natin i-secure using ng bandage clip.
A figure of 8 turn is best when bandaging a joint such as elbow or knee.
So, for the last technique, ang ituturo natin sa ating patient is yung SPICA wrap. So, first, kailangan muna natin sabihin sa ating patient na ilagay yung kanyang arm sa may hips. Okay? And then, sir, again, magro-roll lang po tayo ng dalawa dito sa may biceps. Okay. And then, papunta sa kanyang chest. Then, i-roll po natin kanyang underneath the armpit.
A SPICA wrap is a variation of the figure 8 pattern. It can also be used on ankle or foot.
And then, to terminate, is kailangan po muna natin mag-turn ng dalawa ulit. Then, tsaka po natin i-clip, i-secure with the use ng bandage clip. SPICA wrap is used to protect po or to support if yung patient is may sprain dito sa kanyang shoulder. After the procedure of all different techniques of bandaging, we remove our gloves and discard it, and we need to perform hand hygiene. And document the procedure done and client's response in nurse's notes.